Rheumatoid arthritis, also known as RA, is a debilitating and painful condition affecting women more than twice as much as men. An abnormality in the body's immune system, RA symptoms include inflammation in the lining of the joints and other internal organs. With us to discuss what's being done to help RA patients is Doctor Ara Dikranian, an MD and arthritis and rheumatism specialist with San Diego Arthritis Medical Clinic, a single specialty private practice based in Southern California. And coming up later, we'll meet a woman currently coping with RA and learn what medical science is doing to help manage her condition. Good morning, doctor. It is so great to have you here this morning.
Good morning. Pleasure to be here.
What and who is affected by RA, and what are the major symptoms?
Sure. So there's about 3 million Americans that are affected by RA, and about 70% of those affected are women. And we know that RA is an autoimmune condition, which means it's a problem with the immune system that's manifest in the joints. So the first signs that someone might think they have RA can include things like joint pain and stiffness in the hands, the wrists, and the feet. And over time, this can lead on to other joints and cause loss of function or just difficulty with mobility. But because it's a systemic disease, people can also get systemic complaints like fevers, loss of appetite, weight loss sometimes, and just a general fatigue and stiffness in the morning that can last many hours.
You know, it affects women so much more. Why is that?
Yeah, we don't really know, but some of the theories are that some of the genes that make people susceptible to rheumatoid arthritis are found on X chromosomes, which women obviously have 2 copies of. And we know that there's hormonal influences such as estrogen. Pregnancy can play a role sometimes in terms of the onset or the severity of rheumatoid arthritis. And we also have to remember that conditions that are found in women more commonly, like osteoporosis and pregnancy, these play a factor when we're trying to choose medications that are appropriate for the RA patient.
As the disease progresses, do patients typically recognize ongoing symptoms as like the new normal? Is this how I have to feel?
Yes, absolutely. It's quite remarkable how patients adapt to a lot of the difficulties that they face. And it's actually quite motivating to see patients with challenges like pain and difficulty moving their joints and stiffness adapt and sort of find that new normal. So it's encouraging that we now have therapies to help patients with this and improve function in a lot of cases, in cases where patients have had physical impairment from their symptoms.
That's wonderful.
Yeah.
Why is RA worse in the morning?
Yeah, it's not really clear, but it seems to follow a circadian pattern or a daily pattern. And we know that certain types of mediators of inflammation are found more commonly in the very early morning hours. And therefore, so patients trying to sort of wake up in the morning and get their day going find it pretty challenging, especially in women. Now, we have to really remember that women are trying to get ready, going to work, trying to get the kids off to school sometimes, and in the early morning hours when they're having stiffness and pain, it becomes quite a challenge. So again, some of these symptoms that are more predominant in the morning have various therapies that we can offer and generally help with that stiffness and pain in the morning.
That's good to know. Doctor, we're going to take a break, but when we come back, we'll find out how patients are coping and what can be done to manage the symptoms. We'll also meet a woman with RA, and she's here to share her story, so don't go away. There's so much more coming up on The Balancing Act. We're back, and we've been talking with Dr. Ara Dikranian, an MD and arthritis and rheumatism specialist from San Diego. And joining us now, here to share some of her medical story, is Jennifer, a patient coping with rheumatoid arthritis. And welcome, Jennifer. Doctor, we're so glad that you're here with us today. And Jennifer, before I share your story, I want to turn to the doctor again, and I want to ask, doctor, how do you really treat RA?
So RA has many different treatment options available now. We have old and new medications, targeted and general medications, all of which help to reduce the signs and symptoms of RA. And among these various options is prednisone, which is particularly useful for reducing inflammation in rheumatoid arthritis. And the particular type of prednisone that I like to use in my practice is Rayos, which is a delayed release prednisone. Rayos is it's approved to treat as an immunosuppressive or anti-inflammatory agent, and it has a broad range of indications among various disorders, including rheumatologic conditions like rheumatoid arthritis.
Great. Jennifer, I know you were recently married. Congratulations, by the way. That's so exciting. But some things, at least in your life, socially, were being affected by your condition. Your family and your friends noticed things. Tell us what was happening with you.
So I found myself very fatigued. I was just tired all the time. And then I had this pain in my hands and fingers and wrists that would just kind of come and go. And I would end up having to cancel plans with people because I was either too tired or I was in too much pain. I just didn't feel well overall.
Did any other parts of your body hurt?
Yeah, I had, depending on how bad my symptoms get, when I flare, my hands and wrists again are involved, and my feet and ankles, and at one point my knees were so swollen I couldn't even walk up a flight of stairs at home.
Wow. What are you doing currently to combat these symptoms?
So currently I have 3 medications that I take every day, one of which is Rayos. I also have a medication that I inject every couple of weeks, and then I have pain medications as I need them.
Wow, you seem so young. Doctor, is Jennifer typical of some of your patients that you treat?
So Jennifer's actually a little bit younger than the typical patient. Usually it's middle ages is when rheumatoid arthritis has its peak prevalence, but she provides a great example of someone whose rheumatoid arthritis is relatively early in its stages and may be more amenable to various treatment options in that scenario.
Doctor, side effects to certain types of medication can be a patient-doctor issue, and talk about how that could relate to dealing with RA.
Of course, yeah. We always have to balance the efficacy of any therapy with potential side effects, and particularly as it relates to Rayos, we have to consider that Rayos being a type of prednisone shouldn't be taken, for example, in people with allergies to prednisone. We also have to remember that Rayos can increase the susceptibility to infections, or it can worsen existing infections. It can also affect various hormones in the way the body responds to stress. It can cause eye problems such as glaucoma. It can cause slow growth in children. It can also cause fluid retention, mood and behavior changes, increased appetite and weight gain. It can also reduce the bone density, and especially in postmenopausal women, we have to be careful about that. And we also have to be careful in people with certain gastric and intestinal disorders who are at risk for perforations. So all of these need to be discussed, and the risk-benefit ratio always needs to be modified. And what we always aim to do is to reduce the dose of Rayos to as low as possible to help mitigate some of these effects. So obviously the side effects here are not a comprehensive list, and we always encourage patients to talk to their physicians or visit the Rayos website if they want a more complete list of information about safety.
Sure. Jennifer, are you seeing and feeling improvement?
Definitely. I have more energy, so my fatigue is better managed, and my morning stiffness is definitely decreased. I still have good days and bad days, so it's not, I don't think you're ever a fix-all with the RA. It's just balancing your life and the disease and going based off how you feel.
So doctor, before you leave us, any closing thoughts?
Certainly. For people that suspect they might have rheumatoid arthritis but yet aren't diagnosed, important to engage with physicians in order to get a proper diagnosis. And for those who have RA, is really to understand that their symptoms can be minimized with various treatment options out there. Rayos is one of those considerations of a medicine that can be used, and patients should get in touch with their doctor to discuss those options.
Great information. Thank you so much for coming, both of you. And if you'd like to learn more about RA and medical advances, simply visit us at thebalancingact.com or share with us anything related to the topic of RA by logging on to Facebook /The Balancing Act Fans.